Alright, so I'd come into the patient's room. Hi, my name is Laine. I'm going to be your student nurse. Can I go ahead and get you to state your name and date of birth for me? Thank you very much. Okay, have you ever had this procedure done before? We're going to do your IV today. Good. Okay, is there any preferences that you prefer? No? Alright, then we'll go ahead and do this arm. Are you allergic to any chloroprep or betadine? If you don't know what betadine is, that includes shellfish. No? Okay, so I'd go ahead and provide privacy for the patient, and then I'd go ahead and hand wash. And then I would go ahead and I'm going to start with getting my IV solution ready. So I'd pull this off. Go ahead and unhook this. And I would want to make sure that the medication was within the rights of medication administration, and make sure it's the right solution that the doctor ordered. And I'm going to go ahead and hang it. Okay. You'd want to fill this up halfway. Okay. And then you want to make sure it went all the way down to the bottom. Okay. And it's flowing to the bottom, so then I'd go ahead and stop it. And I'm going to go ahead and hook up my alligator clip. Now that's done, throw that away. I'd go ahead and start setting up to do the actual IV. So go ahead and set out everything. Tegaderm, it's my cleaning solution, cannula, tape, and my tourniquet. So I'm going to go ahead and get my tape ready, that way I'm not messing with it with my gloves on. So I have that ready now, and then I can go ahead and set up my catheter for priming, my extension set. This is the solution. I'd already pre-drawn it. Okay, go ahead and put that in. And have that ready, and I can go ahead and uncap this end, but I want to make sure that I leave it in the package to maintain sterility. There we go. So keep it in the package like that, and set that on the side. Okay, and now I'm going to go ahead and choose my site. We'll do this thing right here. So I'd go ahead and clean it. You want to clean it all the way. And dispose of that. Go ahead and put my gloves on. Okay, go ahead and get this ready. Get my tourniquet. And I'm going to do this a little bit above the side that I'm going to be doing it on. And I want to make sure that when I do it, you do it away from, without that going towards the patient, so that you don't have anything flailing in your way. Maybe. And then we'll go ahead and get started. And you want the bevel up. I'm going to do it right here. And I want to go in at a 10 to 30 degree angle right into the vein. And I want to wait until I see flashback. So I can go ahead and say I see flashback. So then I want to occlude and push in and pull out at the same time. Okay, so then remove. And I would dispose of this in the sharps container. For right now, I'm just going to set it down, not recapping it, but out of the way. And then I can go ahead and hook up my extension set. Now that that's on, I can go ahead and remove. Release my tourniquet. Put that on the side. And then I would want to go ahead and flush it. And tape it down. That way it has a, just in case the tegaderm were to come off. And I can go ahead and remove this after I flush it. And I will go ahead and remove my gloves, throw those away. Initial date and the gauge and the time. 1, 2. And then you just put it on right over the side. And you pull it away. Just like that. And then you can put on your date and time sticker. And then we can go ahead and hook up to the actual movie itself. So we want to undo the tip. to the gator clip like that, and leave that hanging. And then you'd set the drop factor to what the doctor ordered. And that's how you add it. And you'd clean everything up whenever you were done. So I would dispose of all this. And then for video's purpose, I'm going to go ahead and go straight into the removal. So I come back in, verify the patient, ask them their name and date of birth, tell them what I was doing, I was removing it. So I'm going to go ahead and get a gauze pad ready, and I have another piece of tape. So we'd go ahead and turn this off. So move it out of the way. And then go ahead, unclamp it from the bead. And get rid of that. Go ahead and remove the tape from the patient. And dispose of that. Get my gauze ready. Put it over and pull out, making sure that the cannula was completely intact. And tape the gauze pad on. And that's it.